Gentlemen, I want to ask you a question many of you carry quietly but rarely speak aloud. Is what I'm doing normal for my age? This is the kind of question that creeps in during the late hours when your body feels unfamiliar, when energy levels have shifted and routines that once felt effortless now require thought. You wonder if your habits are appropriate, whether you're overdoing something or not doing enough, and whether the sensations and urges you experience are signals of health or early warnings of strain. That private uncertainty is normal and valid, and you don't have to shoulder it alone. You are not the only one asking these questions. I've spent more than 30 years working with men who wrestle with the same doubts about aging, vitality, and sexual health. Over those years, I've seen how silence creates fear and how myths spread faster than facts. That's why this conversation matters. In this video, we'll remove the shame and the guesswork and look honestly at what men over 50 need to know about ejaculation frequency, what the evidence actually shows, what changes with age, and how to read your own body's signals. At the end, I'll teach a simple, drug-free practice I recommend to patients, a practical routine that can protect prostate health, conserve energy, and help you feel more balanced without pills or gimmicks. Let's get started. Section 1. What the science actually shows and what it doesn't. We'll begin with the research because there's a lot of confusion and a lot of headlines that don't tell the whole story. One highly cited long-term study tracked more than 30,000 men for almost 20 years and reported that men who averaged roughly 21 ejaculations per month had a lower incidence of prostate cancer. That works out to about 4 or 5 times per week, which on the surface sounds like a clear recommendation. But important context is routinely left out of the headlines. Most of the men in that study were younger, men in their 20s, 30s, and early 40s, whose hormones, recovery speed, and baseline energy differ markedly from men in their mid-50s, 60s, or 70s. In other words, you can't simply lift that number and paste it onto someone decades older without considering physiological changes that come with age. So let me be blunt. Treating those younger cohort numbers as a universal target for men over 50 is misleading and can be unhelpful. Leading clinical authorities and major medical centers suggest a far more individualized, sustainable range for men later in life, commonly from about once or twice a week to roughly once every 10 days. And that range explicitly includes any form of release, whether partnered sex or solo practice. The fundamental point is this: frequency alone is not destiny. How your body responds after release is the real barometer of health. Go too long without any release, and some men report pelvic congestion, increased discomfort, or urinary urgency. Push beyond what your energy and recovery allow, and you risk feeling drained, foggy, or emotionally unsettled. So shift the focus away from hitting a fixed number and toward noticing how you feel afterward. Section 2. Stop comparing. Your body has its own rhythm. One of the biggest traps is comparison. We habitually measure ourselves against our younger selves, the days when we could go hard and recover fast, or against friends who may be exaggerating or simplifying their experiences. Social media and popular culture amplify unrealistic images of male performance and create a sense that there is a single right frequency or standard to meet. That simply isn't true. There is no single normal that fits every man. Some men thrive with 2 releases a week. Some feel best spacing them out to 10 days or longer. Others may find an entirely different rhythm that aligns with their health, relationships, and daily demands. Your rhythm is not a performance metric. It's an indicator of your current hormonal state, energy reserves, mental clarity, and emotional well-being. Like sleep, appetite, or exercise, it shifts with stress, diet, physical activity, and life circumstances. To help you tune in, ask yourself weekly, do I feel better or worse after I release? Is this urge driven by physical desire or by emotional habit? Is my lifestyle supporting my natural rhythm or working against it? The honest answers to those questions will free you from guilt and from unrealistic comparisons. Section 3. How to find your personal frequency. So how do you discover the rhythm that's right for you? Start with listening and collect a little data. I give my patients a simple 3-step approach you can use immediately. First, track how you feel after each release across 3 domains: physical, muscle fatigue, pelvic comfort; mental, clarity, mood; and emotional, calm, irritability, connection. Second, observe your follow-up energy over the next 2 to 3 days. Do you bounce back quickly or do you feel drained for an extended period? Third, make gradual adjustments, not drastic changes. If you notice persistent depletion, lengthen the interval between releases. If extended breaks leave you restless or tense, try reintroducing release more gently and mindfully. There's an important nuance here. Many men over 50 report a benefit from slowing down and making pleasure more intentional. That doesn't mean abstaining or policing yourself. It means approaching sexual activity with awareness, attending to breath, sensation, and emotional context. Instead of defaulting to habit, the benefits go beyond the prostate. You'll likely experience greater emotional presence, improved relationship quality, and clearer judgment about what your body actually needs. Section 4. A practical habit to support pelvic rhythm. As promised, here is a simple, natural practice I recommend for supporting pelvic circulation and comfort, something to use whether you've had a recent release or you're going through a longer break. I call it the warmth and breath routine. It's easy and takes 10 to 15 minutes. Heat a towel until it's comfortably warm, not hot. Fold it and rest it across your lower abdomen while seated or reclining. Alternatively, sit in a warm bath. Close your eyes and take slow, diaphragmatic breaths. Inhale through the nose, feel the belly expand, then exhale fully. As you breathe, visualize blood flowing into the pelvic area, carrying away tension, and inviting gentle relaxation. Repeat for several cycles and do this a few times a week, especially after prolonged dry spells or when you feel pelvic tension or urgency. Many men report improved sensitivity, reduced urgency, and a calmer sense of rhythm after a few weeks of consistent practice. It's simple, safe, and free. A low-cost way to support circulation and awareness. Final thoughts. You are not broken, you're evolving. Gentlemen, hear this plainly. You are not broken, and you do not have to prove anything. Aging is not a failure. It's a shift in priorities and physiology that asks for different habits and greater attention. This phase of life is less about competition and more about attunement to your body, your energy, and your relationships. If you've been worried your rhythm is too frequent, too rare, or simply confusing, consider this permission to stop chasing perfection and start listening to your body with honesty and compassion. If this message landed with you, I'd welcome your thoughts. Drop a comment with your biggest question about aging, vitality, and sexual health. Let's build a respectful space where men can share and learn without shame. If you found this helpful, subscribe for more clear, science-informed guidance aimed at men over 50. Take care of your rhythm, and it'll take care of you.